Hello everyone, this is Dr. Jaitly. Here I'm going to be talking to you about mitral stenosis, or MS as it's known as in this video vignette. Interestingly enough, mitral stenosis is very prevalent in some developing countries, and now also because of a resurgence of rheumatic heart disease in developed countries, we are starting to see mitral stenosis once again. So anyway, it is the valve. Now looking at this panel on the left side, it's the mitral valve which fails to open fully, completely during the LV filling time. When is the LV filling time? It's in diastole. Remember, the left atrium and the right atrium, they're shown on the top, right ventricle and left ventricle here at the bottom. Now, when the left atrium contracts or empties, the mitral valve should spread wide open so that the flow easily comes into the LV normally. Now, in a setting where the valve is rigid, in a setting where the valve is thickened, in a setting where the valve is fixed or fails to open or moves very little and leaves a small orifice open only, that causes the left atrial pressure to become higher and higher and higher. So in other words, left atrium is making an extra effort to squeeze through this rigid valve or thickened valve or a small orifice valve into the left ventricle. So obviously the left ventricle is not getting enough blood because left atrium is still trying to squeeze during the diastole for a longer period of time and sending blood into the left ventricle to an extent that the cardiac output can still be relatively maintained initially, at least. So what's happening? You have a higher gradient between the left atrium and the left ventricle during diastole. That means, now remember, systole and diastole is always in reference to the ventricles. So during the filling time, the left atrium is trying to send blood into the left ventricle, not so successful, unfortunately, and therefore all these small little arrows that I've shown produces turbulence across the mitral valve. And that sounds like a diastolic murmur to the person who is auscultating with the stethoscope. So that's one of the features that is very definable in a setting of mitral stenosis in clinical examination. In fact, the diastolic murmur has a presystolic accentuation because the patient is in sinus rhythm and the left atrium has so-called a kick that it gives during the actual systole, and that's what causes this presystolic accentuation. But just remember for now, a diastolic murmur which is heard at the apex is a part of a clinical sine qua non almost of mitral stenosis. Now remember, this murmur is very localized. It's only at the apex. One does not hear anywhere else. It does not conduct anywhere because it's a diastolic murmur. So mostly it's at the apex and heard best in the left lateral position and also with the bell of your stethoscope. These days the stethoscopes have only one diaphragm, so that's pretty good. But in good old years, they used to have a dual bell and then a diaphragm on the other end. But a bell of the stethoscope will actually accentuate that murmur much more audibly to the human ear. Now, what are the causes of mitral stenosis? Let's shift that for a second. Now, coming to the central panel here, rheumatic heart disease is still the leading cause in mitral stenosis. And that occurs because the mitral valve and the aortic valve, they both are afflicted because of the rheumatic heart disease that develops during someone's childhood. And then later on, initially starts with the rheumatic heart fever, and then later on, as they say, it licks the joint and bites the heart. So that's what is happening. It'll cause, it's a same old dictum here. So the heart somehow gets the scars of the mitral stenosis here. Congenital with or without ASD. That means there is a condition with ASD, atrial septal defect, where the mitral stenosis is commonly seen. That's a congenital variety, and it's called Leutenbacher syndrome. Just for your reference, and you can remember it, you may not remember it, that's a different issue, but just for your sake. Endocarditis is still a very important cause, and one should understand that endocarditis is still very prevalent and causing mitral stenosis, even though regurgitant lesions first occur and then stenosis. So stenosis is a later phenomenon in the endocarditis variety. But a large vegetation, for instance, if that's sitting on the mitral valve here or here, what will it do? It'll cause obstruction, obviously, the mitral valve, even though if it may be moving, but that's coming in the way. This huge ball-like thing may be sitting here, and that could be a mitral vegetation. Similarly, a left atrial myxoma, which is a benign tumor. Normally, it's anchored from the interatrial septum or from the free wall of the left atrium, and that has a little cord-like thing, and then it sort of keeps flopping back and forth inside into the mitral cavity or the mitral ring or annulus, and as a result, it may cause intermittent mitral stenosis. So it has a similar murmur, it has a similar presentation. So just as a differential, one should know that left atrial myxoma can manifest also as mitral stenosis, and later on only on a 2D echo Doppler it can be differentially diagnosed. So features are exertional shortness of breath. The patient says that I cannot walk beyond 10 blocks. I used to walk 20 blocks, or I'm not able to walk a couple of blocks. I used to walk 5 blocks, or I have to stop by each time whenever I have to go up the stairs. I have to stop in between the steps and stuff like that. So a lot of, and specifically as it advances, then person is not able to sleep well, and he or she will require an extra pillow. Sometimes they barely sleep. They sleep in a reclined chair or on a sofa, etc., and they just fall asleep because it's called paroxysmal nocturnal dyspnea. So long term, but just remember they are breathless during the sleep. Also are awakened during the sleep from breathlessness. Many times when they cough up, when they wake up, they'll have some sputum, and that sputum could be blood tinged, and that's because of the hemoptysis. And we'll talk about the causes about all of these things later. And then, of course, the right-sided failure sets in, where the liver enlarges, called hepatomegaly. The ascites occurs, where the fluid collection occurs between the peritoneal cavity sheaths, and ankle edema. So these are the right-sided failure features. Now, sine qua non of on the echocardiographic findings are obviously a thickened mitral valve leaflet which fails to open, a large left atrium, and a very small left ventricle. That gives a clue that there is something going on in this mitral valve, and that is most likely mitral stenosis. Now, when you do a Doppler will define actual gradient and define the severity of mitral stenosis, because as I said, the left atrium gradient or pressure rises during diastole, and when it's trying to squeeze the blood into the left ventricle barely has any pressure because it's only filling and low pressures, and so there's a huge gradient between left atrium and left ventricle during diastole, and that gradient, the severity of the gradient, will define what kind of a mitral stenosis we are looking at, mild, moderate versus severe. Okay, well, thank you for your attention, and more later on mitral stenosis as we move forwards, and I hope you're finding this interesting. Thanks, bye.